Hey, I'm Dr. Joe Niamtu, LoveThatFace.com, and I know you heard this before, so I'll say it really fast. I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here, and I don't do boobs, bellies, and butts. Facelift is one of my most popular procedures, and I do over 100 a year. And I just did a video recently on, do you need to sleep upright after facelift surgery? And you know, most doctors, and I did for decades, tell my patients that they had to sleep upright or at least elevated after their facelift. So you can look at that video, and basically the crux of the video is that so many people just can't sleep when they're sleeping upright. So they come in the next morning after their facelift, they're really tired, they were up all night. And there are other reasons why sleeping upright may not be the best thing to do. Number one, you're upright or elevated and all the gravity brings the swelling down this way. Number two, when people sleep upright, they tend to do this and they flex their neck, and you can have a problem. We refer to this as tech neck, because when people stare at their phones after facelift surgery or their tablets, anything that would cause flexing in the neck and bending in the neck there, that can fill with fluid and then organize into a hard band that can last a long time and be difficult to go away. Finally, our lymphatic system, which drains the inflammatory fluids after surgery, when you're laying down, you're actually allowing your situation to drain into the lymphatic system. When you're sitting up, you're really not draining. So we want people to drain into their unoperated lymphatics, which are more in the back, and by laying down, that may even actually help your swelling. But what I really want to talk about today is this. This is an airline pillow, and it can be very useful with facelift surgery. Now, some patients, you know, they think they want to use this like this when they sleep, and I'm not a big fan of that, because again, they can put pressure on their facelift flap. But if you are going to sleep, and I tell my patients after facelift, just sleep in any position you want. If you want to sleep lying down, that's fine. If you want to sleep on your side, that's fine. And I know that flies against what a lot of people say, but I think my patients do better when they do that. Now, one thing about sleeping on your side, whether it's the night of your surgery or 2 weeks after your surgery, patients have a lot of soreness in their ears, or their ears are numb and it feels funny. So using an airline pillow, not like this, but like this, where your ear is in the center of the pillow, and that can be a lot more comfortable. So if you're sleeping laying flat, you can use the pillow behind your head. If you're sleeping on your side, you can put your ear in the middle, and that supports everything. So I think these are very handy to have if you use them the right way. And I hope this adds a little bit to my thoughts about post-facelift recovery and sleeping in an elevated position. Now, I do want to say one thing. I get a lot of people commenting. They say, well, my doctor wants me to sleep sitting up. Listen, follow what your doctor says, okay? Because 99% of the time, whatever they tell you works for them and has worked for many patients over a long period of time. So listen to your doctor. If you come here, I'm going to tell you that you can sleep flat the night of your surgery. I'm Dr. Joe Niamtu, LoveThatFace.com.